Mr. Vice President, the French physician who conducted the small pilot study showing that a malaria drug, it's called hydroxychloroquine, which is basically a malaria pill, and Z-Pak, which is azithromycin, stops the coronavirus infection, told me on my show that denying these medications, I'm going to quote him, is unethical. Now, the FDA appropriately desires randomized clinical trials for proof to guide the medical community. How can we accelerate these clinical trials while also satisfying the demand from physicians, frontline docs, who want these pills for their patients and themselves? Countries like China and France are already using them more widely. And, sir, a very personal question. Would you take these pills if you fell ill today?
Well, first, Dr. Oz, let me thank you for your encouraging words to the American people throughout the coronavirus. And frankly, that would go to every one of the doctors on this panel on Fox. We're grateful to each of you. The good news is the chloroquine medication, we actually deployed in the state of New York resources to be able to be administered to people. But I'm pleased to report to you, doctor, that the FDA is approving off-label use for the hydrochloroquine right now. Doctors can prescribe that medication, which, as you know, is a perfectly legal and approved malaria medication. But doctors can now prescribe chloroquine for that off-label purpose of dealing with the symptoms of coronavirus. We're making that clear across the country. As you know, and I'm sure the president will say this when he joins us in a bit, the president's very optimistic. He's very hopeful that some of these anecdotal results that we've seen around the country will prove out to be true. But I want to assure you, there's no barrier to access to chloroquine in this country. We're working to add to that supply even as we speak. We're working with companies like Bayer that produce vast amount of chloroquine, but at the same time, to your point, we are engaging in a clinical trial while we make this broadly available for off-label use, because we do want to take the opportunity, and we're doing that in New York State, to study the results of this so that we can better understand the impact going forward.
Have you been able to answer his question about whether or not you would take it if you felt you needed it, Mr. President?
I would follow the advice of my physician, and I would recommend that approach to every single American.